Hi, and welcome to Transplant Qi Gong. We're going to start out with some breathing and with a little joint mobility warm-up. So we're going to start with our feet facing forward and our knees and feet relaxed. We're going to tuck the pelvis just a little bit. So we're tucking the pelvis and engaging the pelvic floor. Shoulders are over the hips and head is facing forward. And we're just going to let our arms come out. As the hands are facing down, spiral the hands toward the heavens. Inhaling and now exhaling down. And again, relax the feet, relax the knees, pulling up, inhaling, and exhaling down one more time. Letting the arms come up, becoming present with the breath, inhaling, and exhaling. And we're going to start with the wrists. So in Qi Gong and also in yoga, we start with warm-ups that warm up the joints and the muscles and the tendons. And that's good just to warm up the body, but also because energetically we have meridians that run through the body. And lots of them run through the wrists and the ankles. And so those are very important places. So for instance, as we do these wrist mobility warm-ups, we're clearing the channels for the heart and the small intestine and the lungs and the large intestine. These run down the arms as we move into the elbows. Nice circles with the elbows, and the hands are soft. The other thing we're doing here from a sort of Western perspective is we're updating the Google map in our head of where our body is in space. We call this the proprioceptive map. And that tells us where we are and how to move more efficiently. Makes our balance better, and it generally improves our overall mobility as we start to roll the shoulders forward, up, back, and down. Good. One more, and reverse. So this little warm-up is good to do before any kind of activity, whether it's a sports or just when you get up in the morning before you go face your day. But it's an excellent way to get ready for your Qigong or yoga practice. Good, and now bring the hands onto the hips and spiral the hips around. And so we're keeping the head in the center and we're moving the hips around, really opening up the hips and all of the channels in the legs. We feel this go all the way down to the feet. And down the legs, we have the liver and the kidney and the spleen channels down the inside of the legs. We have the bladder and the gallbladder channels down the outside of the legs. So very important. And reverse this. Also, the center of the body, this is where we cultivate our energy. So we want to wake the center of the body up. We talk about this in both yoga and Qigong. In yoga, we call this Khandasthana, the center of the body where the digestive fire is. And in Qigong, we call this the lower dantian. It's where we store and cultivate our energy. And one more. And back. And now we bring our feet together, with our big toes touching and our ankles touching. And we're circling and rotating our knees. This is great for starting to warm up the knees and the ankles. Two more in this direction. And now reverse. Starting to warm up the ankles. We want to do a lot of foot and ankle and hand and wrist work because these are the keys to flexibility in the body, and also lots of receptors in our hands and feet, the way that we experience the world. And also, as a transplant, one of the things that happens to us is we get neuropathy. Now we're going to come and stand on our left foot and bring the right heel up, and then just spiral the foot around, pressing into this ball of the foot and rolling it as if we're rolling, just like the same thing with our hand here, and reverse. So either as an underlying disease condition or as a side effect of some of the medications that we take as transplants, we have these neuropathy, which can be very annoying and painful. And there's drugs for this, but also by doing these kind of mobility movements. And now we're going to switch sides, bring the left heel up, standing on the right, and roll. This helps wake up the nervous system, and we can actually repair some of these pathways. I had neuropathy early on as a type 1 diabetic in my teens and 20s, and it was very unpleasant, and I was on medications, but I'm completely fine now. Of course, I'm also blessed to be 16 years out from a kidney pancreas transplant, so the body can definitely heal itself. And 2 more in this direction, feeling that nice rotation go all the way up the knee into the hip and down. Good. And now just 1 more for the neck. Drop the chin down and roll gently, looking to the right, and then drop the chin down and gently looking to the left and drop the chin down. And one thing, I have a chair here beside me to demonstrate that all of these could be done in a chair. If for some reason you're in a chair or even in a hospital bed, these can all be done in a chair. And as we move into some of the Qi Gong exercises in a little bit, we'll show some of them in the chair. You can also use the chair if you have any issues with balance. Be sure and be careful and take care of yourself in terms of your balance. Last one, and back to the center. Good. And come up. So now we've warmed up pretty much all the major joints in the body, and we should starting to be feeling a little bit warm right now. So we're going to, again, take the arms up, drop down, feel that we're pulling energy up from the earth, and then we're connecting with the heavens, and we're bringing that energy down. Feel our body is calmer now, more awake. Come up, inhale, and come down. And one more time, come up, inhale, and come down. And stand. In the next segment, we're going to go through the opening meditation.